Tai Chi intervention and looking at the specific effects of that. A second NIH-funded R01 is beginning to explore Tai Chi as an exercise maintenance strategy after pulmonary rehabilitation. So we know that for patients with COPD and many other pulmonary populations, pulmonary rehabilitation is actually very helpful. However, compliance is poor, and for the most part, we know that after pulmonary rehabilitation, after the program ends, all the clinical gains pretty much disappear within 6 months because the patients do not continue to exercise. And so how do we keep these patients engaged in exercise over time? So our hypothesis, again, Tai Chi, with its multiple components, has different elements that inherently are similar to what's taught in pulmonary rehabilitation, including upper and lower extremity endurance and strength training, aerobic exercise, and breathing retraining. So our hypothesis was that since Tai Chi may increase exercise self-efficacy and provide psychosocial support, this may facilitate exercise adherence, increase overall activity over time, and this hopefully will translate into improved and maintained clinical outcomes over time. So in the interest of time, I'm going to stop with this slide, but I'll leave you just as with this slide as an illustration of the of other exciting and interesting Tai Chi studies that are going on at Harvard and with others in Harvard collaborators. There's a study of autonomic control of the cardiovascular system during different yogic breathing patterns. A study that Dr. Wayne mentioned looking at healthy aging Tai Chi and specifically at the complexity of heart rate dynamics. Another study of Tai Chi exercise for obesity and cardiovascular risk factors, and a study for Tai Chi in patients with depressive symptoms. So I want to also acknowledge and thank our NIH sponsor who's provided support for many of the studies mentioned. Thank you very much.
Our third speaker is Dr. Helene Langevin. She is the medical director, she is the director of the Osher Center for Integrative Therapies at Brigham and Women's Hospital and Harvard Medical School. She is a visiting professor at Harvard Medical School, and she also is professor of neurology, orthopedics, and rehabilitation at the University of Vermont. She's going to talk to us about what are the mechanisms underlying the evidence that we've been hearing about during the last 2 mini lectures, and in particular looking at connective tissue.
Good afternoon. It's a great pleasure to be speaking with this great group in honor of World Tai Chi Day. And I'm going to be talking about something that's a little bit different and related to Tai Chi and to many other types of treatments, and focusing on connective tissue. Now, we've all heard many times already by Dr. Wayne and Dr. Ye that Tai Chi is a multidisciplinary activity that involves many parts, many different components. Ranging from relaxation, mindfulness, retraining of the neuromuscular system, exercise, and stretching. Now, if we think about many of the chronic conditions that Tai Chi may actually benefit, it's very clear when we start thinking about these conditions that these conditions are not simple either and involve many different components. And so it's important to think about a lot of chronic diseases ranging from chronic pain to chronic obstructive pulmonary disease, that there's a lot of times a dual component to these, and we call psychosomatic, in a sense that there's a sort of psychic component, in a sense, emotions, behavior, actions that are actually part of the condition, and the somatic component is the actual physical component of the problem, and that there's an interplay between these different aspects of it. And if we think about it, I like to think about it as in a very dynamic way, in a sense that as we go through life, everything that we do, all of our activities, all of everything that we do essentially determines the shape that we take on and as we evolve through life. For example, if we have a habit of sitting a certain way, gradually, over time, our body, our physical body, remodels as a consequence of the way that we sit. And so there's a constant interplay between the activities that we have and the matter, the physical matter of our tissues. And so, and the same thing goes in the other direction. If our bodies remodel a certain way because of certain, say, habits of posture, or we do certain sports, or we use one side of our body more than the other, well, eventually, as our tissues remodel, that influences what we can and cannot do. And so there's the circle kind of goes in both directions. So I cannot ever be not reminded of the sort of yin and yang circle when I think about this, because that's essentially what yin and yang sort of theory tells us, is that there's a constant interplay between sort of the active, sort of dynamic aspects of anything in the universe, including human beings, and also the sort of more solid matter-like aspects of, for example, in our bodies, which are, you know, the bones, the muscles, the cells, the tissues, etc., the more dense kind of yin aspects of our nature. And so we can think about it in that way. And of course, Tai Chi embodies this in a sense that it will have, as both previous speakers pointed out very elegantly, that there's an interplay between the various different aspects of the body that a dynamic and complex intervention such as Tai Chi acts upon. So, for example, relaxation would impact like the autonomic nervous system. Mindfulness will have an effect on sort of the whole regulatory control of the body, and neuromuscular retraining could alter the movement patterns, and as well as both being influenced by the emotions. For example, the fear of falling that Dr. Wade mentioned. Aerobic exercise would have a more direct effect on the cardiovascular tissues, right? The arteries, the heart, the veins, and the stretching component on the musculoskeletal system, right? And so all of this, importantly, is that there's, again, these effects are not independent of each other. That's very important. What I'm going to do in this talk will reflect the interests of my particular lab and research group, which is the effect of stretching. And I'm going to be talking about the effect of stretching on a particular aspect of the body, which is of very interest to us, which is the connective tissue. So this talk from now on is going to focus on very narrowly on one thing, which is the effect of stretching on connective tissue. But again, I want to emphasize that because of this dynamic interplay, it's very clear to us that even though the stretching, for example, may impact connective tissue at a physical level, that's not where it stops, because influencing the structure of the physical body will then carry over into the totality of the individual's function. So stretching, of course, is nothing new, and any of you who have animals at home or observe animals in nature, we can see animals stretch. It's a spontaneous thing, and humans do it too. We do it spontaneously. We stretch because it feels good to stretch. But what exactly happens when we stretch? Besides feeling good, is stretching good for us? And what happens physiologically when we stretch? And if we don't stretch enough, do bad things happen? And if we forget to stretch certain parts of our body, and that can begin pretty soon in childhood, as I notice in my own children, we sometimes forget, and is that not good? And if we injure ourselves and we are not able to stretch, if for whatever reason, for a period of time, what happens? Are these effects? What are the effects of this on the body? And what are the tissues that are stretched when we stretch? We think when we do stretching exercises, a lot of times we think of stretching muscles, like for example, when we have our tight hamstrings that we like to stretch. But there are other tissues, the connective tissues, that are the tissues enveloping the muscles, that go around every structure of the body, not just the muscles, the bones, the nerves, the blood vessels, that also are in the organs, the lungs, the heart, the liver even. There are connective tissues everywhere in the body, and these connective tissues can be more dense, in the sense of densely packed tissues, or they can be looser, what we call areolar tissues, and they really form a network throughout the body. Now, when we have an injury, for example, we can see that the connective tissue remodels and changes as a result of an injury. This is an example here in a mouse model where we have these very thin lines, blue lines here, of dense connective tissue separated by layers of more loose connective tissue. And when we do, this is a special experimental injury that we look at the effect of, and if you just very, very delicately separate these two layers and then let this is in this case an experimental animal, and then let the two layers heal for 7 days, excuse me, you see that the two layers become thicker. I'm losing my pointer here. And in some cases, they can actually fuse together, and that causes what we call an adhesion or a contracture. Okay, it's essentially a scar inside the body that can prevent the movement of the tissues and range of motion. We became interested in the lab in chronic low back pain and the possible role that connective tissue could play in low back pain. There's a lot of people who suffer from chronic low back pain who do not have X-ray abnormalities or MRI abnormalities of intervertebral disc, for example, diseases, or any indication of where the pain may be coming from. And we're interested in the lab in whether the pain may be coming from the connective tissues on either side of the back of the spine. And we did a study of over 107 subjects who had chronic low back pain and compared them to matched controls. And what we did is we measured the thickness of what's called the thoracolumbar fascia, which is an area, it's a sheet of connective tissue in the back that we can measure with ultrasound. And if we look at this white structure here, that's the thoracolumbar fascia. In some patients, it's a little bit thicker. And then in other patients, you can see it's very thick, and it looks even disorganized. And when we measured the thickness of this area down here, we saw people with low back pain. It was thicker than the controls by about 25% on average. And we also looked what's called the echogenicity, the amount of echoes that are generated by the ultrasound during the exam, and that was increased as well. We also was wondering, if this increase in thickness was also associated with differences in how the connective tissue was mobile. This connective tissue in the thoracolumbar fascia is composed of several layers that all are connected to muscles with different directions of pull. Some muscles pull longitudinally, up and down, and other muscles pull transversely. So it would make sense that these muscles, these connective tissue layers, would have some independence of motion. And you can actually see these layers here on the ultrasound as these dark bands separating the white bands. And so here we did a test where we asked, instead of just taking an ultrasound image in the human subjects, we asked them to lie on this motorized table, prone, so their head here, feet there, and then what the table does is it flexes like this. So essentially the subjects are bending back and forth passively, okay? And in response to this, we looked, and this is a movie that illustrates how the connective tissue layers here within the thoracolumbar fascia are moving not all at the same rate. You can see that some of these layers here are moving in the contrary direction to the layer immediately above it, and so I hope you can appreciate that at this distance. But so there's a certain amount of what we call shear plane deformation that occurs between these layers. In contrast, this is a subject with chronic low back pain, and the layers don't seem to be moving quite as much. It actually looks like the layers may even be stuck. And this is reminiscent of what we see in the mouse that has had the injury. So we see a decrease in the mobility between the layers. We can actually measure this using a technique called ultrasound elastography, where we can calculate the shear strain separating these layers. And in the patients, this was a study, again, of 116 subjects with low back pain and controls. And we can see that the shear strain, okay, the amount of shear deformation is decreased in the people with low back pain. So there's less movement. So we're wondering, the next question is, well, okay, if this connective tissue could be involved in pain, is it possible that stretching could improve the health of the connective tissue? So we did an experiment in rats where we actually caused inflammation of the connective tissue, because we were wondering if this pathology or sickness that we are observing in the connective tissue in people with chronic low back pain may be due to maybe some kind of chronic inflammation that may actually affect the tissue. And so we were attempting to look at this experimentally by inducing inflammation in this tissue here by injecting an inflammatory substance, and then subjecting the animals to a form of stretch that was actually developed a little empirically in my lab by rats. When you hold them by the tail, and this is very gentle, it's not something that actually doesn't hurt the animal, but we allow the rat to grab onto the edge of the table, and then spontaneously they extend their back feet, and they essentially are stretching their thoracolumbar fascia this way. And it's similar to some, poses that in certain yoga type exercises, which is very interesting, I think, that the rats spontaneously adopt this position. And we compared that to an intervention where we're simply taking the animal out of the cage and holding by the tail, but not suspending them. And it's important that the animal is not completely suspended off the ground. They're still able to hold on and be in contact with the ground. And so one of the things that we looked at is how the animal was walking. We can see that the animal that has the carrageenan has a reduced stride length, meaning that it's not walking as much and as well. And the stretching, this is a sham intervention, does not change things, and the stretching completely reestablishes the stride length of the animal back to normal. We also looked at the sensitivity of the animal to touch on the back, and using something called von Frey testing that looks like looked at mechanical sensitivity, and you can see that it's increased with the carrageenan and decreased again with the stretch. So the stretch decreases the amount of sensitivity that the animal has. We also looked at inflammation itself in the back by looking at the amount of inflammatory cells. These are macrophages that indicate the amount of inflammation that there is. And we can see again that the stretching compared with the sham decreases the amount of inflammation in the tissue. So it seems like the stretching is actually helping. Just to show you that we can actually measure this with the ultrasound, similar to what we do in the humans. So I just want to also mention that we're also interested in our lab not just to look at the connective tissues as far as tissues are concerned, but also we want to look deeper into the tissues and look at the cells that are in the tissues called fibroblasts. I don't know if you can see these cells very clearly, but we do experiments where we do some stretching of the animal, both in the animal, a live animal, but also sometimes we take the connective tissue after the animal has been euthanized, and we stretch the piece of tissue in the lab, in a dish essentially. And we look at the response of the fibroblasts. These are the cells that are in the tissue, in the connective tissue. And we see that the fibroblasts respond to the stretching by changing shape, and we can measure this, and we can see that the fibroblasts in the stretched tissue are larger and different from the fibroblasts in the non-stretched tissue. And we can see that the stretching and this expansion of the fibroblasts is accompanied by some signaling. This is ATP, which is a signaling molecule, is released into the connective tissue in response to the stretching, and this is one of the mechanisms by which the fibroblasts can change shape. And importantly, ATP is a molecule called a purine, and that has been implicated in sensory signaling and can even be converted to other molecules that may have analgesic effects. So we are very interested in this type of signaling that occurs in the tissue. So, again, I think one